Hi there, welcome to AGRC 223. This is Unit 2, Digestive Diseases in Animals, and what we're going to do in order to make this section a little bit easier to listen to is to break it up into shorter than 15-minute segments as you listen to the lectures here. So we're going to record a few different parts, and as we skip through the objectives here, you can read those. And in part one here, we're going to talk about foot and mouth disease in primarily ruminants, bloat in ruminants, hardware disease in ruminants, and then get to impaction, which covers several different species. So let's jump into the content here. So foot and mouth disease, certainly not very common as you consider all the diseases of the digestive tract that you would start to list. Foot and mouth disease is way, way down the line. However, an extremely, extremely problematic disease, and whenever you see the on a slide somewhere related to a disease where we've tracked outbreaks, you can already tell that that's something that the federal government takes high priority in monitoring. And so we've got 9 recorded outbreaks in U.S. history, the last one being nearly a century ago in 1929. Foot and mouth is very, very, very highly contagious and extremely febrile, and probably of all the animal diseases that we'll discuss throughout the class, this one maybe causes the highest body temperature of all of them. So it affects cattle, swine, sheep, and goats. Horses are resistant, but the primary outbreaks that you'll know through history are generally associated with cattle. So if there is even a suspected outbreak, you are required by law to report it to the state vet's office. And then immediately they're going to come in and quarantine your operation to try and establish control. And even though we've not had an outbreak, and not even, to my knowledge, a suspected case in quite some time, this remains on the state vet's office, remains at the USDA level, high area of interest as a threat to the industry. So if we look at the cause of it, it is a viral infection, and we have identified 7 strains, additional subtypes that can cause it, and it could be caused by any combination of those. And so if you see animals, if you had encountered an animal that happened to be carrying this particular problem, they would suffer repeated outbreaks if they didn't just right up and die from it. So if they establish immunity to one of the 7 strains, they don't establish any cross immunity to any of the others. So that's part of what causes it quite problematic. As we turn to transmission, during the febrile phase, you'll find the virus in just about every way that an animal can shed, whether it's saliva or the blood, the milk, the muscle. And even that virus remains alive in the carcass, the animal byproducts, so it can contaminate feed, equipment, utensils, anything that you've got on the farm, the soil even. And so anything that comes in contact with those infected animals is a contaminated material. Clinical signs, what you see whenever this begins to outbreak, is you'll see really a lot of blistering and extremely painful looking blistering, especially in the mouth area. Then you can kind of hone in on any of the soft tissue areas on the animal, whether it's the mammary system, the palate, the cheeks, around right at the top of the hoof, where the skin transitions to the hoof is kind of a soft tissue area. You'll see vesicles there, and they'll rupture within about the first 24 hours, and you'll see all kinds of different things. And I asked the question here, what other symptoms might you see? Well, clearly they're going to be off feed. They're probably going to be rather listless. They're going to lag behind the herd. All of the symptoms that cause you to know that you've got a fairly serious disease on your hands. The body temperature is going to rise really, really quickly and extremely high within the first 48 hours, and then is going to fall back close to normal, and that's something that you would then be really concerned about. And so you might see the infection actually localized in a major organ. You might see abortions, mastitis, etc. Again, why the USDA tracks this one so closely is there is no vaccination. There's nothing out there that that you can give them to prevent it. So other preventative measures then must be put in place. So again, federal restrictions, if you have any susceptible areas of the state, the country, the world that might be experiencing a foot and mouth outbreak, those are going to be restricted areas. Any products or byproducts coming from any of those suspected areas are going to be contaminated and therefore contained. And so immediate quarantine and then eradication of infected and exposed animals, severe cleaning and disinfection, and then even if you had to eradicate your operation, they would restock that farm with a few susceptible animals to the test site to see if that bug is still there, if that virus is still living on the farm. So it's a really, really concerning and crazy disease. Very, very thankful, like I said, that we haven't seen one in a long, long time in the United States, because you would see the USDA and the veterinarian's office mobilize very, very quickly in order to help contain this particular problem. There's really no treatment in the U.S. that we know of. There's no treatment at this time. And again, I can't reiterate enough, you must report that suspicious case to the government. They've got to know about it. It is a crime not to, because this one can travel airborne. It can travel from spot to spot. We've talked for many, many years about the movement of livestock throughout the United States and the lack sometimes of quarantine structures and quarantine practices, and this one would travel quite quickly from space to space. So again, be on the lookout for that one, although I don't want to scare you. It's not one that, like I said, that's very common. We've not seen it in a long time, but one that you probably need to keep in the back of your mind. Let's transition to talk about something much more common, and that's bloat. When you think about ruminants, bloat is something to be on top of all the time. This different than foot and mouth. This is a non-contagious disorder in ruminants only. And what happens is you have an excessive accumulation of gas in the first two compartments of the stomach, and especially the rumen. And for whatever reason, that animal has the inability to expel the gas. Not necessarily too much gas production. Gas production stays on the normal pathway, the normal production rate. They just simply can't belch, is what it boils down to. So animals can become really, really acute, meaning they'll get it really, really bad and then never get it again once they get over it. Or you can have ones that we get to know as chronic bloaters. And at least in my experience, the ones that I've come across that become chronic get it as younger calves or younger steers, and then for whatever reason they're really susceptible to it. They kind of have a stomach that gets in a place where any little bit of feed upset or stress and they're bloated. And those chronic bloaters don't tend to do very well over the long-term span of their lifetime. There's really, when we look at causative agents, there's not really a specific cause that you can point to all the time, or very little agreement on the causes. There's a lot of associated factors, whether it's genetics and animal susceptibility, whether it's the type of feed that you're feeding, which is one that I think is most common, sometimes just the environment in which it is fed that cause it. And some of it is lack of enough coarse roughage, the density of the feed. Saponins or soaps or glycerols, that one is another one that I think is highly important as you think about the combination of feeds in the diet. Some of them cause much more gas in the rumen than others, and you'll get kind of, if you picture as I talk about it, adding bubble bath to your bathtub at home and forming those big piles of bubbles in your bathtub. Those are saponins, and whenever there's gas trapped in that bubble, it cannot be expelled. Toxic substances occasionally can be associated with this. A lot of saliva production or composition sometimes maybe causes it. There's a lot of different things that we consider as causative agents, but we don't really know for sure what tracks them down. Clinical signs then, severe distension of the left side of the animal. Could even stretch up over the top line of the back and move over to the right side, and you would be looking at a very, very, very serious animal at that point in time. If you have really overweight animals or sheep, that it's hard to see, but they'll start to go off feed. They'll move real uneasily. Occasionally, if you start to hear the grunting sound or labored breathing, you've got a very sick animal. And if it gets really bad, they'll have difficulty standing. But you don't want them to lay down, because then basically what you've added is pressure on the other side of the animal, and this puts tremendous pressure on the diaphragm. So really, they have trouble breathing. Preventative controls here is simply try and reduce or eliminate any causative agents of the list that we talked about there. Specific strategies: don't let animals graze on really highly legume pastures, or feed them really rich legume hay, alfalfa hay. Maybe some coarse grass hay before they go to lush pasture. Dry forage. Don't let them be completely hungry and then eat a whole bunch in a hurry. Don't let them slug feed a lot of grain. Things of that nature will help prevent this. Keep water and salt available. All kinds of different things. Treatment here is prompt treatment is really essential. You've got to know what you're doing. First and foremost, keep the animal elevated. Keep them walking, tie with their front end up high. That keeps some of the pressure going, and that simple walking will help kind of get the gut moving a little bit and help that gas get expelled. In acute cases, you can take basically a garden hose and pass it down into the stomach to try and let the gas off. And got to get those gas pockets out of there. That's one way to go about it. And you got to know what you're doing there, because you can't put the hose in the lungs. Next is the more severe method, and that is trocar and cannula. And basically, you take a trocar and poke the left side of the animal between the hip and the last rib, and let the gas leak out of the side of the animal. And then obviously you've caused a major rupture in the side of the animal. Now you're going to need to start her on penicillin in order to prevent any particular infections that may set in. Okay, then finishing up this particular section really quick and talk about hardware disease. And this is an acute or very chronic mechanical injury to the reticulum. You've got basically a piece of wire, a screw, something poking through the side of the reticulum. And historically, wire, and specifically fence wire, accounts for about 75% of the cases. It's much less common today, especially with our TMR feeding systems that have magnets on the TMR mixers. It's less common for you to have this particular problem, but anytime you have animals out on pasture, ruminants can be susceptible to hardware disease. You'll find they'll just kind of stop eating, they'll lose a lot of weight, they'll stand awkwardly because they're being caused pain, they're being poked internally. Sometimes febrile, usually elevated respiration rate. So the best way to prevent this is to put magnets in your animals. That will help pick up any stray metal that gets into their feed that they're consuming. That magnet usually hangs out permanently in the reticulum and never bothers them. And it's not a problem at all to put it in there. If you suspect you've got a case of hardware, treat them with antibiotics to help control the infection. Maybe administer another magnet, or give them the first one if you don't know if they have one. And then really, really severe cases require surgery to repair and remove that piece of equipment that's in there. But obviously that's pretty risky and oftentimes not very successful. So that hardware oftentimes causes what we call peritonitis, which is an infection within the body cavity, or pericarditis, which is an infection in the heart, because the reticulum sits right next to the heart cavity area. So if you don't catch it early, that can be a real problem. I've seen it kill animals before. So you want to be aware of this particular one on the farm. That's going to close out kind of section 1 here, part 1 of the Unit 2 online lecture. Thanks for listening.